over quite a large area. So that's also led to innovative uses of technology and the flexibility and highly responsive approach to meeting medical healthcare requirements, and I'll go into some details of that shortly. Just looking at the how we sort of rank globally, three areas where New Zealand health IT providers in particular are attracting major international attention and investment are in regional electronic health records, EHRs, for solution and implementation, clinical management systems for hospitals, and practice and clinical management systems for GPs. So we have 90% of our primary healthcare physicians and 100% of our laboratories communicate via secure health data networks every day. And the outcomes have been generally quite good, while they've been driving the health dollar further in New Zealand and probably further than some of the comparable countries that we compare ourselves often with in the OECD. So, what does a small country, South Pacific Island nation have to offer global healthcare providers? Well, I'd like to look now at some of the ways in which New Zealand has achieved the outcomes and also what we have to offer others. Again, as I said, a small country that we can work almost as a social laboratory. So New Zealand has led with innovative approaches to healthcare delivery, which include a national health identifier. Introduced about 20 years ago, this has streamlined the flow of patient healthcare information, improved healthcare systems, delivery and patient outcomes. We're also tackling diabetes, and I'll go into that a little more later. Tackling cardiovascular disease with a combination of healthcare programs deployed throughout the health system. Improving patient outcomes in acute care, and I'll give you some examples of that shortly. Overcoming issues of delivery in remote or out of hospital settings. So that includes training, and it includes a number of other remote delivery solutions that we've got, and I'll give you some examples and show you some pictures later. We also have national screening programs for breast screening and immunisation, and we have what we call a national shared care program, and I'll give you some examples of how that works using IT systems, again for remote delivery. One of the leading suppliers of software for the private medical centres in New Zealand is a company called Medtech. Now, Medtech has a sizable back office in Chennai, here in India, and they do a lot of the development work for New Zealand and Australia and other markets there. They also are developing telemedicine solutions for the Indian rural community out of their Chennai facility. So the software links various parts of the system, including GPs with laboratories, X-ray services and so on in the New Zealand context. And I know this isn't exactly isn't exactly IT, but in terms of driving that health dollar further, there have been other solutions that have been developed by New Zealand companies, and this is one example, the Howard Wright ICU bed. So essentially, it's about the patient, and so the patient doesn't need to get transferred between beds when they're going into an operation. The bed goes with the patient. So in the New Zealand context, it reduces the staff required, and more importantly, reduces the stress on the patient, particularly post-surgery. As I said earlier, New Zealand has a small population, and we're spread over quite a large land area. And that's particularly so in the South Island of New Zealand. And if any of you have been there, it's a very beautiful country, and you can drive for a long way without passing another car. So the people are there, but spread out. Now, what we have is regional hospitals that provide a lot of the main health care and major surgery, and so they're located in the larger cities. But in the smaller communities, it's not practical to provide hospital facilities. So what we have, sorry about that. Nope, that one's not going to work for me. What we have is, you can see, there's two slides there. You can see the one behind is a system called Mobile Surgical Services. And what it is a large truck and trailer unit with an expandable trailer section, which develops into a full-scale state-of-the-art operating theatre, and you can see it in the background to the slide that's up on the screen. I apologise that it's not all working the way it should do. The operating theatre is used for less complicated surgery and is performed remotely by using some of the best surgeons who can see the operation and direct it from other centres, including from offshore. Some of the other remote services, delivery services that we've got are a company called Atlantis Healthcare, which customises programs to ensure patient medication compliance. And what that does is reduces hospital readmission. So again, it drives the health dollar a bit further than it would otherwise. Auckland University has robotic minders for aged care facilities. Orion has a portal for patients to access their own health information. And again, that's quite important because it takes the pressure off the public health system to provide all of that information. Auckland University is one of the world's top 50 universities for clinical, preclinical and health subjects, and a branch of that part of the university provides organisations with research and consultancy services and designs educational programs. There's another company called Venture Health, which is leading mobile health solution provider and provides their solutions in a number of countries. We also know that smoking is the single largest preventable cause of disease and premature death. Now, it's quite a focus in New Zealand because there are communities in New Zealand that are that smoke more than the general population, if you like, and have a number of health issues as a result. Now, one of the solutions that's used, and it's a combination of solutions, is provided by HSA Global. Now, you can see the mobile phone that's placed over the other slide here. That's of a product called Stomp, which stands for Stop Smoking Over Mobile Phones. Now, what Stomp does is send messages to smokers that are trying to quit. So there's a series of customised text messages that people receive on their mobile phones over a 26-week period to help them stop smoking. And this is one of the messages you can see there is Stomp Quiz. As I said earlier, New Zealand also offers training remotely. And one of the companies, for example, is a company called Simtix, which offers surgical training software. Training categories include medical assistant, sonography, medicine and nursing. And the Medvarsity here in India, that's run by the Apollo Hospitals Group, is using that remote technology to provide services in India because, as we know, you've got a large requirement for staff, for medical staff now and going into the future. So these sort of remote technologies are good for training. Now, lastly, I'd like to look at diabetes as a case study. New Zealand has quite high rates of type 2 diabetes, particularly based around the genetic predisposition of the Maori and Pacific Islands population in New Zealand, but also lifestyle diseases, as we know, lead to type 2 diabetes and the associated, obesity and the associated morbidities that go with that. Research has revealed that New Zealand has one of the highest rates of diabetes amongst developed countries, and drawing attention to the causes and prevention of the disease. So, as we know, India faces some similar challenges, with approaching 75 million cases in India, and soon 1 out of every 5 patients in the world will be with diabetes will be an Indian. So, what we've done about it in New Zealand are a number of solutions, and a number of companies provide those. One of which is a company called Orion. Thank you. One of which is a company called Orion that has worked with the public health system in drawing on decades of data from the health system on the best treatments, and they've incorporated that into a program of an advisory program for doctors dealing with patients for the disease, so they can use the history of a range of patients over 40 years to advise. There are a number of other complexities that relate from obesity, and so there are programs like Get Checked, as you will see up on the screen there, which is a Ministry of Health program that people can register for on diabetes. Aran's Medical, which we've got up here, offers leading-edge wound assessment and management systems, and they offer that in 19 countries. The Synthesis is a regenerative medicine company that offers extracellular matrix for wound and tissue treatment. Comvita is quite an interesting company because it uses traditional medicine from New Zealand. There's a tree called the manuka tree in New Zealand, and the Maori people used to use it for treatment of wounds. They would take the bark and put it on the wound, and it healed the wound and helped it heal